this is just the beginning.
Hello, and welcome to our Fitness and Fighting Infections virtual event. I'm Kendall Baker, sports editor at Axios, and I'm coming to you from Axios HQ in Arlington, Virginia. First, a thank you to Planet Fitness for making these conversations possible. I'd also like to welcome our audiences on Facebook, YouTube, Twitter, LinkedIn, and of course, Axios.com. You can follow along today using the Axios event hashtag and at Axios on Twitter. Over the next 30 minutes, we'll be discussing the science behind fitness and how people are maintaining health in these trying times. Our first guest is 17th Surgeon General of the United States, Dr. Richard Carmona, who's joining us from Tucson, Arizona. Dr. Carmona, how are you?
Well, thanks so much. Pleasure to be with you.
Thanks for taking some time. And I just want to start off with, a status update from you on the pandemic. I think we're all following along. We've gotten some positive news recently in terms of the vaccine, but you're the expert. I think, you're who our audience wants to hear from. So I'd love to get a kind of a status update where things stand from your perspective.
Well, I think the science has moved along very well. It's been, a real challenge because of the partisan politics, the conflicting information. But when we look at what the nation has accomplished in less than a year, for the first time in history to have a vaccine or several vaccines available for public use, that is a reportable event. So kudos to the scientists, my colleagues, Dr. Fauci and others at NIH and CDC and all the private sector who came together to make that happen.
Yeah, it's always nice to get that perspective as well. It is, trying times, but we have accomplished quite a bit. Obviously this event is about fitness. And so what are your thoughts on how the pandemic has impacted kind of exercise and physical health in the country? On one hand, lockdowns, gym closures have people cooped up. There's some concern there around people being sedentary. At the same time, personally, I've never walked more. I know a lot of people are spending more time outdoors than ever, just because of that cooped up feeling. So there's almost maybe some hope as well. So what is your read on, the impact the pandemic has had on physical fitness?
Well, I think it's safe to say that COVID-19 has disrupted our entire social structure, including exercise. So kudos to you for going outside and taking a walk and staying physically active. But there are others that rely on a gym, on some type of a closed space, others who can't go outside, maybe people with disabilities or healthy people that rely on interactions with instructors. Then there's the social aspect of working out in a gym. So all of those are desirable now because more and more we're being secluded and we understand that we are human beings. We thrive on social interaction. We see our seniors being locked away and we can't hug grandma, grandpa. We can't meet with our trainers in the gym. So all of these things have a mental health impact as well as a physical health impact. So the important message here is keep moving all the time. If you can't get into the gym, that's fine. But for those places, the gyms that have the ability to stay open based on their local guidelines, that are using the best public health practices to ensure there is no transmissibility of disease, I think that's another option too, and one that we should embrace as much as possible.
And you mentioned gyms, and of course, again, we're talking about physical fitness. It seems, mayors, politicians, business owners, you're constantly making these decisions, basically balancing public health with these very legitimate concerns of small businesses like gyms. How do you balance that? From your perspective, it is almost an impossible task. But what is your perspective on balancing public health with legitimate concerns from a business perspective?
It's a great question. And I think, first and foremost, whatever you're doing, we have to adhere to the best public health practices, social distancing, wearing a mask, stay within your own bubble at home. Don't be interacting with lots of people you don't know, things like that. Now, when you take it to a gym, well, there are a number of places like Planet Fitness, like Canyon Ranch, the University of Arizona, for instance. Well, we've kept the student gym open, but you have to have a mask. The students have been tested. There's social distancing. There's teams that clean up immediately at each location. So we've had almost no transmissibility within the campus, for instance, or from what I understand at Planet Fitness facilities. But you have to really step up and make sure the staff is on board. There's a team approach. There's cleaning. There's social distancing. There's masking. Machines are separated, for much further apart now so that we have the social distancing. So I think when those best public health practices can be applied, we should consider letting those facilities stay open when possible, based on epidemiologic data, because people need that social connection. More and more, it impacts our mental health when we're isolated. Doing exercise at home is okay, but after a while, you get lonely. And we are social beings, and we thrive on those interactions. So mental health and physical health are connected inextricably.
And you mentioned, masks, separating machines, I guess optimizing for ventilation. When we talk about gyms, and fitness centers and places like that, is the list longer than, like, what else can a gym be doing kind of proactively? Obviously, they have to, follow guidelines, but they can also be preparing for the future. They can be preparing for when they can reopen. Like, what can a gym be doing? And then as a customer of that gym, what should they be looking for their gym to be doing?
Well, first and foremost, what I said on the public health practices. The other thing, as we look at options, where you have an outside area, move your gym outside, especially if you're on the West Coast. We've seen a lot of the gyms move into a courtyard, move into a parking lot, like restaurants have done. So there's even more, and as more social distancing, plus the airflow is good to be able to prevent transmissibility. But where you're looking in the Midwest or in an area where it's cold and that's not possible, then making sure that there is a playbook, that there is a process, there are protocols in place. So this is not done ad hoc. It is actually spelled out clearly what each person's responsibility is in the workplace, as well as those members who would go to the gym, what is expected of them. That honor system, that if you're sick, if you have a fever, if you're living in a house that somebody has COVID, do not go to the gym. So when you check in, you should be able to say, I've not been around anybody, I'm feeling healthy, I'm not coughing, I wash my hands frequently, I will wear a mask, I will stay socially distant here, I will make sure that the instructors and the cleaning teams are cleaning up after each machine is used. It's a partnership. We all have to be vigilant to prevent transmissibility. So those are the things that are most important as we move forward. And to your point, this is a pandemic that we haven't seen in 102 years, since 1918. We don't know when the next one is there. So let's memorialize, let's institutionalize these best practices. So when and if, and we hope it doesn't happen, but if it does happen, we are better prepared.
And you mentioned restaurants, and I think there's been some kind of confusion or ambiguity about what businesses should be open, what should be closed. Do gyms get lumped together with restaurants? Should they, shouldn't they? Where do you feel like gyms fall in that equation? I mean, on one hand, at a restaurant, you are taking your mask off to eat. At a gym, assuming you're following guidelines, you're not taking your mask off. So you could make the argument there that a gym is safer. On the other hand, you're sweating in a gym. Maybe you're sweating at dinner. I don't know. But I mean, where do gyms fall in the equation? Are they safer than restaurants? Are they less safe? Everything seems to be lumped together, right?
Well, I think the important thing that we have to preface all of our remarks is we are inventing these processes as we go along. The metaphor, we're in the plane at 30,000 feet and we're learning how to fly it right now. Right. And so this is all new to us. As I said, we haven't had anything like this for over a century. So I don't know that we can readily compare one to the other, but I think what's important, the first questions that need to be asked, what is societal value to be able to do this thing? Eating, going to a gym, recreating, whatever it happens to be. And then, can I do it safely? And if so, what are the measures I need to take in a restaurant, on a hiking trail, in a gym, so that I can continue to do these things? And every day we're learning. If you look at how things have changed just in the last 6 months or so, with people trying things and the studies that have come out as far as transmissibility, looking at droplets and how it spreads, and all of that has helped us and informed us every day. So I expect that these policies and procedures will continue to evolve as we learn more of transmissibility and how we can prevent that transmissibility. So I think any entity that wants to continue working, whatever that entity happens to be, that's the approach. What's the societal benefit? How can I do it safely? Because the other part is the economy. People are out of work. People are worried about losing their homes, losing their cars. Children can't learn in the environments they're being put on now. It's foreign to sit in front of a screen instead of a teacher and learn from fellow students in elementary school. All of those things are very, very important. So we have to continue asking the right questions, societal benefit, processes that need to be put in place, and the public needs to work with the business owners to make sure in this partnership that we're doing everything we can to decrease transmissibility. And it may vary from city to city, state to state, based on disease prevalence and disease incidence in those communities.
Great. And then last question for you. You mentioned, we're constantly learning, and it's so true. And we're constantly learning in terms of transmissibility. We're also, I would hope, constantly learning in terms of immune boosting benefits and susceptibility and recovery. Is there any evidence to suggest that exercise it makes you less susceptible? Is there any evidence to suggest it helps with recovery? Where does exercise come into play in terms of those things as opposed to transmissibility?
Well, in an integrative approach to health, which includes mind, body, and spirit, we know that they are all inextricably tied together. The fact that we can't interact with others and exercise as we did, we get depressed. We yearn to get a hug, a handshake, a high five, whether you're young or whether you're old, especially in the senior population. So when we look at those connections, mind, body, and spirit, how they inextricably tie together, it's important to recognize that it's hard to separate those things. These are things that we as humans need to do to stay healthy. And we should do everything we can to stay connected, continue moving, so that it helps our immune system as well as our mind and our body, and helps to offset the mental health problems like depression.
Absolutely agree with that. Well, thank you so much, Dr. Carmona, for joining us. Really appreciate you taking the time. I am now going to throw it to my colleague, Axios co-founder and CEO, Jim Vandehei, for our View from the Top segment.
Thank you very much, Kendall. It is now my pleasure to bring you a conversation with Chris Rondo, who is the CEO of Planet Fitness. Chris, thanks for joining us.
A pleasure, Jim. Thanks for having me on. Appreciate it.
Explain to the viewers what makes Planet Fitness distinctive in sort of in the gym, workout, health center category.
Sure. Yeah. I think the thing with the gyms or fitness centers as a whole is they really have us lumped into one big broad group. And there's many different models out there. There's the small boutique chains, which are call it 800 to 1,000 square feet, more like a yoga studio or spinning studio. And then you have, our fitness centers, which are about 20,000 square feet, big open and spacious areas, not different rooms for different exercises, just a big open box, a lot of air filtration, a lot of spacing, social distancing. And then you have the multi-purpose clubs, which would have the saunas and the jacuzzis and juice bars and things like that. So it's very different sections of the gym industry, but fitness centers with Planet Fitness, big boxes and open and spacious areas with not group settings or group classes, which is very different.
How many of your facilities are open, have been open?
Yeah, so we have 2,100 total clubs. Right now, we have about 1,800 open as of now. We started reopening stores back in May and have done so very safely. We've actually logged over 100 million workouts, 113 million to be exact, and have had no cases of contraction or breakouts in any center so far, and over 100 million workouts of that.
We'll go a little deeper on that. There's obviously, I think, to a lot of people who might not go to the facilities, the sort of tension of, man, I'm putting on the COVID-15, I'm not getting out, not working out. That has an effect on our immune system. It certainly has an effect on our mental health, our happiness. But they might worry that I'm going to go into this gym and there's going to be a bunch of people sweating and hacking, and are they going to catch COVID? Why hasn't that happened in your facilities? Like, what do you do to make me safe?
Sure. So, in our clubs, because they are spacious, like I mentioned, we have cleaning stations and sanitization spray readily available for all members to use as well as staff. So scattered throughout the facility. And our member etiquette that we strongly enforce is that people clean the equipment before and after every single use. And social distancing is also what we play a part in our clubs. And in our cardio, for example, in these times, we have every other piece inoperable. So people are forced to stay apart from each other. And with 20,000 square feet, we'll be able to really space people out and have proven to be very safe along this way. And even pre-pandemic, the unfortunate thing here in the U.S. is we're already underneath an epidemic. 70% of the U.S. adults are overweight, 40% are obese, and leading to stuff like heart disease and lung disease, diabetes, you name it. And when you look at the different mobilities that fitness centers in general can help hopefully cure or stay people healthy from, leading into COVID-19, unfortunately, we're seeing what that does to people who have pre-existing conditions. So I really think that we're part of the healthcare delivery system and really the first leg in that stool. Planet Fitness, but fitness centers in general. So I think longer term, we really got to look at this industry as being an essential business.
There's a tendency, I think, with some politicians, some folks in the media, when they're talking about restrictions on what any of us can do, they'll often lump fitness facilities in with small bars or restaurants. Mm-hmm. How much of a struggle is that at the local level or at the state level to be able to make the case, to be able to keep your facilities open?
Yeah, it has been. Unfortunately, this industry, they lump us in hospitality, which seems kind of odd, right? And with hotels, casinos, and bars. And, in fitness centers in general, people don't congregate. They don't hang out and talk to each other in close proximity. They get in, they work out, they get on with their life, So I think, unfortunately, we're lumped into bars and restaurants and even movie theaters for that case. And we really need to get ourselves out of that arena and make sure they look at us as really part of wellness, mental health, physical health as well. But it's been a struggle. But I think the data we're starting to produce now, showing them how we've operated safely, they've really started to listen. And Governor Cuomo just came out just this past week saying that gyms are not the cure or spreader of the COVID-19. So I think our data is finally being listened to and making an impact.
Most of your facilities have been open. What are you seeing in terms of sort of collectively our workout habits? Are people working out more, working out less? I assume fewer people are working out. What are you seeing? What should we know?
Yeah, so I say the boomer population, the older clientele aren't working out as much, unfortunately, and not joining at the same clip as they were. But as far as the people working out, they're working out the same as they did before. Even our new joiners, which is important to know, our new joiners and really catering to the customer that we go after, which is the casual and first-time gym goer, because our membership's at $10 a month, so we're really opening the door for more people have access to fitness. And 40% of our new joiners today have never gone to a gym in their entire life. So we're truly getting people off the couch and making fitness a part of their regimen.
And you've made changes when I go to work out in terms of things that would keep us safer, healthier, cleaner. Well, of those, what will live on post-COVID? Like, imagine the vaccination comes, the virus goes. Are there things that you will do differently in terms of how you operate your facilities post-COVID based on the learnings of what we've gone through?
Yes, for sure. We have now in our app, we have a lot of workout videos and exercises for personal instruction to learn how to exercise. It's been adopted like crazy. I think just digital in general, whether it's barcodes at restaurants for your menus, I think the digital world has really accelerated. So that will be something that will stick forever. Your barcode for your check-in at the front desk is now in the app and you self-check in. So I think that'll be something that lasts, forever. We also have a crowd meter we designed in our app, believe it or not. So real time before you leave the house, for example, you can see how busy the club is before you leave, so you can avoid the crowds if you feel some angst around them. So the crowd meter is real time. It tells you exactly the busyness of the club before you leave. So a lot of this stuff we'll use longer term, and it's really helped us really understand the customer's desire to learn through digital. And 20% of our app consumption right now for the workouts are actually not even Planet Fitness members. They're actually at home utilizing our exercise routines from our app. So it really is introducing the brand to more people, which longer term is only better for us.
And Chris, as we wrap up, it is obviously a big component of just all of us owning our own health, owning our own behavior. Like, what would you tell me if I'm coming in to a Planet Fitness to work out in terms of like, what should I specifically do? Should I always have a mask on? How often should I be washing my hands or wiping down the machine? What is the proper health etiquette?
Yeah, so we have in our clubs, we have a universal policy nationwide of mask on when you walk in and walk out of the facility and while you're walking around, but not while you're actively exercising. In some states, it's about 13 states that do require the mask 100% of the time. So in those states, it's a little bit different. So it's mask 100% of the time. But we recommend that you wash your hands before you begin exercising. And we have lotion, sensitization lotion throughout the facility for people to use, free, people grab it. And then we have the spray and the cleaning agent and paper towels to use for people throughout the facility. So just really keep your distance, clean the machine before and after every use, and just mask up when you're not exercising. And we're proven to be really, really effective with that. And it's been great. I work out at my local Planet here in Seabrook, New Hampshire. And besides the mask, it feels pretty normal to me. And it's great to see people of all ages in there working out and staying active through all this.
Thank you, Chris Rondo, for a fascinating conversation on what I consider to be a very important topic. I don't think people focus enough on the benefits to our immune system, to our mental health of working out on a daily basis. So thank you to you, and thank you to Planet Fitness for making this broader conversation possible. And over to you, Kendall.
Thank you, Jim. So my next guest is the mayor of Long Beach, California, Mayor Robert Garcia, joining us today from Long Beach. Mayor, how are you?
Good. How are you? Good to be here.
Thanks for taking some time. So, I just want to start off, how are things in Long Beach? I think we're all, paying attention to this thing from our living rooms, but hearing from someone like yourself who is, hearing how the challenges that your community is facing on a day-to-day basis and the work you're doing in response. We'd just love to hear, how's it going?
Yeah, I think this week, obviously, especially is a hopeful week because we do know that the vaccines have landed in California, and actually shipments are going all across the state to various cities, including ours, which we'll receive this week. And so on the vaccination front, we are very optimistic. We expect to start here in just this next week, begin vaccinating all of our hospitals here in the Long Beach area. There's 5 hospitals here within our city, and those are doctors and nurses, medical personnel will receive the vaccinations first. We also have a series of nursing homes and skilled care facilities, so all of the residents who are really in critical care, as well as those that work there will also receive their vaccination. Then will be paramedics and EMTs. And once we get through all of those folks with this first batch of both the Pfizer and Moderna vaccinations, then we move on to essential workers. So the vaccination front is positive. I will say, though, that COVID-19 as a pandemic issue and as something that's a challenge is harder than it's ever been. We continue to lose more lives in California. We're at a peak when it comes to infections. That's also the case here in Long Beach. And so it's still very much a very serious issue on the ground, but folks are hoping that the vaccination process is going to help.
Appreciate that update. And I want to touch on your proposal for a personal services and fitness resiliency fund to support gyms and other small businesses in Long Beach. Can you just kind of give us some details on that and why you see that as such an important move to make?
Yeah, I think a lot of cities, particularly urban centers, have these really great kind of fitness economies, and I think that small gyms, personal training gyms, whether it's places that are doing CrossFit or whether it's yoga work or other types of fitness gyms, boxing places. These locations are almost always small businesses. It's folks that love what they're doing, and they've been hardly hit by this pandemic. We know that for most of them, there had serious closures that occurred over the summer. Right now in Long Beach and in California, many remain closed. Some are able to operate outside. So that the state does allow outdoor training, of course, safety protocols in place and distancing. So this is an industry that's been hit very, very hard. And in a place like Long Beach or Los Angeles or other places like San Francisco and others, you also have a diversity of folks that are running these operations. And so you're really hitting these small businesses very hard with these closures, which we understand for safety reasons. And so the fund essentially is we put in $5 million to start and likely grow. So that we can provide grants. These grants can be $25,000, $30,000, $40,000 grants that will go directly to these gyms so that they can bridge those months they've been closed on the rent or have some dollars to when they fully open back up to get started. So it's critical that we support them. We don't want to lose this critical piece of our economy.
And so for your mayors like yourself, right? You need to support businesses like this. At the same time, you have to balance that with public safety. It is a tough thing to balance. How do you go about doing that? And where do gyms, as you said, and fitness centers fit in relative to, let's say, restaurants or other small businesses who are also hurting? How do you balance the two things? And where do gyms and fitness centers fall into all of that?
I think first, the consensus, the scientific consensus, certainly the medical consensus in California is right now that there's very little happening indoors. Certainly indoors where folks are unmasked. And so everyone is essentially masked in indoor activities right now. And those are really, at this point, really only like food centers, large retailers that are essential for folks to get access to food. Retailers have really limited their occupancy. Indoor gyms are closed. However, gyms can operate outdoors per the state and per the city, and so you are seeing a lot of outdoor fitness happening. The thing about I have a trainer that I'm actually doing Zoom fitness courses with. There's a group of us that we Zoom in a couple times a week, and it's important for people to also have ways to stay healthy, and that's important for not just their physical fitness but also for their mental health. And so, encouraging trainers to responsibly train outdoors, masked, distanced, is what's happening right all across the city. I mean, you see it in all of our parks, you see it in parking lots, and so we're very encouraging of that, as long as it's done in a way that is safe. You can work out outdoors and do it safely if you follow distancing.
And is there anything, gyms across the nation have been making these kind of modifications, whether it's outdoor fitness or what have you? Are there other things that they can be doing kind of proactively to prepare for when they will, hopefully be able to open again, whether that's, optimizing for ventilation or other things like that? Right now, the outdoor exercising is almost like a solution, a temporary solution. Is there anything they can be doing kind of permanently to prepare for that next phase or what comes next?
Well, I'll give you one example, which is my trainer in my gym. So, he is actually totally thinking about what comes next. And in fact, he's going to do a variety of things. He has found that a lot of his clients enjoy training outdoors. And now that they've switched a lot of the training outdoors, he's realized he has a whole new group of clientele that really enjoy the outdoors. So he's going to kind of expand his outdoor footprint and continue those classes. He's also found that he has another group of folks that do like the online training, which is not for everyone. I would much rather, of course, have somebody in person, but you do what you can right now. And so he's also going to expand that out. So I think expansion of the online capacity for folks, outdoor expansion, and then once folks can go back inside gyms and actually studios, people are going to make decisions based on how safe they feel. And so I think that safety, making sure that the most cleanliness strategies are put in place, making sure that things are well sanitized. All that I think is going to matter a lot. And I think is how these smaller fitness studios keep and hold on to these customers they've seen. As the larger places have closed, a lot of the smaller guys have seen more and more customers, and how they retain them, I think, is also a challenge. It's going to be an opportunity for a lot of them.
And it's interesting too that you bring that up, because so much of, or at least for some people, part of the gym is kind of that getting away from work or getting out of the house. There's even a community element to it. And we talk so much about physical fitness right now with everybody kind of locked in at home. You also have mental health to consider there. Is there something to be said for gyms kind of, being more of a place to kind of optimize your mental health, even if it's not during this, but after it? And maybe that's another way that gyms can kind of position themselves as a place to welcome people back once that's possible.
I think gyms, I think in general, are great places where people like to come together and do exactly that. And so I think you meet friends, there's folks that want to stay active, and it's a great place to feel good about your week and about your day. And so I think that gyms have an absolute role to play, particularly on the mental health side, which is really important right now, and we're losing a lot of those connections. I think people want to get back to their gyms. I think people want to go back and go back inside to these places, but we have to wait. The truth is that we're doing the absolute right thing, as painful as it is. At least here in California, because of the numbers, we have to keep them closed. But the outdoor piece is really critical.
And you mentioned vaccine, and I think we're starting to see progress. I think for so long people have been hearing about basically all businesses kind of lumped together. Sometimes restaurants are lumped with gyms, sometimes they're not. What is the messaging you would send to on one hand gyms? People are sweating. You're maybe touching weights. Things like that suggest, okay, maybe that isn't a place I want to go. At the same time, gyms, before the pandemic was even a thing, optimized for cleanliness. They're constantly cleaning. They already are almost prepared for something like this in other ways. Like, what is your messaging to people as they look at businesses starting to open at different times at different rates? Like, are gyms, where do gyms fit into it in terms of like their overall safety, if that makes sense?
Well, gyms that have been able to kind of do an outdoor approach are surviving, and in some cases really thriving. It's an activity that you can do masks. And I understand not everyone can, but most folks can, are able to do it and retain their masks on, and you can distance if you go outdoors. So I think the gyms that are doing it this way, I think, are currently thriving. Obviously, for those that aren't able to go do an outdoors, they're closed, and that's where I think the government's got to step in and provide support. Gyms are not going to all of a sudden reopen on the indoors if COVID cases continue to spike. And so what we do now, as far as the government coming in and providing direct relief to small businesses and to larger gyms as well, I think is critical to ensure they stick around and they stay within our communities. I mean, I love, in our Long Beach community and in our downtown core, you can walk in any direction and run into a small fitness studio. They're just popping up, and they have been popping up everywhere for the last few years. We want to keep those small business owners supported in our community, and should be happening across the country.
And lastly, just going back to the importance of community to stay active. As you said, you yourself are working with your trainer, and gyms are taking advantage of this time to do more outdoor stuff. Like, just being out in your community as a mayor, how important is it for communities to stay active? And maybe is this time, are we able to kind of reflect on, once it's taken away from us to a certain extent, going back to what I said before with gyms, there's a certain community element to it, to fitness overall, and everybody staying active together. Is there maybe a silver lining to all this terribleness in terms of that kind of coming together?
I think that this crisis has really changed us in how we communicate and how we learn. I think that when we come out of this thing, there is going to be obviously a rush to kind of get back to the way things were, and for us to come together in these spaces like gyms and other places that we love so much. But I also think technology has changed the economy and fitness forever. I think that the way we are going to connect with trainers and the way we're going to connect with the community, I've worked out with folks through my Zoom classes and through other opportunities that I'd never had before, that I didn't know, that I'd gotten to know, that I never would have gotten to know inside of the gym. And so I do think it's going to change the way we're going to still want to come together, but these kind of virtual opportunities are also going to change this dramatically in how we work out, I think, and how fitness plays a role in the future, which is why you're seeing some pretty strong sales for fitness equipment in homes. I think you're going to see home gyms. I think are going to be continue to be more popular, and it'll be a combination of that kind of virtual training that you're seeing with some companies that are taking advantage of that now.
Awesome. Well, thank you so much, Mayor Garcia, for joining us today. I really appreciate your time, and best of luck as we move into this next phase.
Will do. Thank you.
And thank you all for tuning in to another virtual conversation that has hopefully made everyone smarter, faster. Thanks to our sponsor, Planet Fitness, for making this event possible. As always, you can find us at Axios.com or on the Axios app. And of course, you can sign up for our newsletters, including my daily newsletter, Axios Sports, at signup.axios.com. And lastly, before you go, we did want to share some news about our expansion into local markets. We will be launching city-based newsletters in 2021 to keep you up to date on what's happening where you live. So for more information about that, check out axios.com/local, and you'll be able to sign up for newsletters and see what's happening down the pipeline with that there. So thanks again, everyone, for joining, and we'll see you on axios.com.